Real news for Americans 50 plus. This is Emeritus News Channel.
Good afternoon, everyone. Influenza is widespread in the country, and illness, hospitalizations, and deaths continue to increase. 41 states are now identifying widespread disease from influenza. That's up from 37 last week. The other states are all seeing either regional or local activity. It's unprecedented for this time of year to have the whole country seeing such high levels of activity. The influenza-like illness that we track with our ILI-Net Sentinel provider system is showing higher levels of illness than we saw last week. Again, these are unprecedented levels of illness. The national average is about 6.1% of doctors' visits are for purposes of influenza-like illness, and that's very high at any time, particularly in October. We also track mortality around the country through something called the Pneumonia and Influenza Mortality Survey with 122 cities. And for the first week this fall, we're seeing that the amount of pneumonia and influenza mortality is above the epidemic threshold. All of these markers suggest to us that it's a very busy and difficult flu season, and we are seeing very high levels of activity around the country. We also have updates on the pediatric deaths, and unfortunately those numbers are going up as well. There are now a total of 86 children under 18 who died from the H1N1 influenza virus, the 2009 H1N1 influenza virus. We had 11 more influenza pediatric deaths reported to us in week 40, which is the week that ends October 10th. 10 of those were confirmed to be due to the new strain, the 2009 H1N1 strain, and the 11th is probably due to that, but the typing hasn't been completed. About half of the deaths that we've seen in children since September 1st have been occurring in teens between the ages of 12 and 17. These are very sobering statistics, and unfortunately they are likely to increase. I want to provide some update about the influenza vaccination program. First, I'm going to speak about the 2009 H1N1 vaccination effort, and then I'll speak briefly about the seasonal flu vaccine program. As we've said for the past couple weeks, we will be releasing twice a week the aggregate numbers of doses that were available for ordering by the states and that were ordered by the states. And every Friday, we will be posting to our website the state-specific information on how many doses have been shipped to the states or communities. That number is on our website now and will give people the best idea of how much vaccine is available near you. We're in the very beginning of this program, and the numbers will be increasing regularly. Today's numbers on the aggregate total numbers of doses ordered and total numbers that were available for order are as of Wednesday. So as of Wednesday, 11.4 million doses of the monovalent H1N1 vaccine were available for order, and as of Wednesday, 8 million of those doses had been ordered. For comparison, earlier this week I briefed you about Monday numbers, and those were 9.8 million doses available for order, so things increased by 1.6 million there, and 5.8 million doses had been ordered by the states. So between Monday and Wednesday, an additional 2.2 million doses were ordered by the states. These numbers are going to be changing regularly, and what we'll be seeing over time is progress, with increased product becoming available for order, increased orders being placed, and increased shipments out to the states and providers where vaccine can be given. It is very early in the program. I wanted to provide an update about where we're going to be going in the future. It's very difficult to predict exactly how many doses we'll have in the weeks ahead, but we do want to let people know that some of the manufacturers have let us know that the production of vaccine is likely to be a bit delayed in terms of the number of doses they were expecting to have out in future weeks. We wish that we had more vaccine, and there is more vaccine coming out every day, but it doesn't look like we're going to be able to make those estimates that we had projected for the end of this month. The production estimates are going to be lower by the end of this month, but there'll be more vaccine coming out regularly. So we do still expect to have a large number of doses that we've been talking about, so that eventually anyone who wants to be vaccinated will be able to be vaccinated. But the next couple weeks will continue to be a slow start. Forecasting flu vaccine production is difficult. As we've been saying over the months past, we can't with precision estimate exactly how much we'll have at any one time. There are many steps involved with producing vaccine and then with testing and releasing vaccine. And so we unfortunately won't have as much by the end of this month as we had hoped to. We hope that by the end of this month and early next month we'll be able to have widespread availability of vaccine, and it'll be much more visible to people in communities. But the delays that the manufacturers have let us know will have an impact, a substantial impact for the states in their planning efforts. They are directing vaccine to providers and school-located clinics and pharmacies and so forth, and this delay is going to shift some of their planning. So you may be seeing some rescheduling of some clinics, and again, we're just all going to have to bear with the situation. We wish we had better ways to produce vaccine perfectly predictably, but this is how influenza vaccine production often goes. All the numbers that I were giving you are really just a snapshot in time, and things will be increasing again every day and every week. And again, we do think by the end of October and early November there'll be widespread availability, and it'll be much easier for people to find out where to be vaccinated. I want to briefly turn to seasonal flu vaccine. We've been hearing some people's frustrations about that. There's been lots of interest in being vaccinated with the seasonal flu vaccine, and it was available earlier than ever this year. So far, 82 million doses of influenza vaccine have been distributed. That's 5 million more doses than were distributed last week when I reported these numbers to you. And we expect a total of 114 million doses over the weeks and months ahead. The season production is estimated to be at about 114 million. So we're at 71% of all the doses that are going to be produced that have already been distributed. Most of the seasonal flu effort is a private sector entity. The public sector only buys about 10% of the vaccine. So I'm reporting to you where we are with that, but it's not something that we're directing or in the middle of, just something that we care deeply about and want to help facilitate the uptake of. I want people who are trying hard to find seasonal flu vaccine to know that there's time. We know this is frustrating. Keep looking. More vaccines coming out every week, and we do think there's time for you to get your seasonal flu shot or flu spray. We don't usually see the seasonal flu disease increase until December to May, so there is more time with that. Of course, virtually everything that's circulating right now is the 2009 H1N1 influenza strain, and that's why we're so keen to get vaccine out as quickly as we can with that. Just to wrap up, this is a challenging time. It's hard to see these increases in illness, and particularly the severe illness that we're seeing in young people and pregnant women, people with asthma and chronic diseases, something that is challenging for all of us, and I know in your communities is challenging as well. We are seeing more and more vaccine become available. We wish it were more than it is, but at least we have some, and we've started vaccinating both in school settings, in hospitals for healthcare workers, and local health departments, and in some other venues through providers' offices. And there'll be more and more coming online regularly. We are working very closely as a public health system with the private sector, state, local, and federal health department efforts, working together with the private provider community and the manufacturers to really try to deliver for the American public. And so the next couple weeks will continue to be a bit challenging, but there is more vaccine coming. Reminder that there's a lot of information on flu.gov. Particularly want to remind people who are worried, who have children with asthma, diabetes, are pregnant, about warning signs to look for, about how to make sure that you seek care promptly. Lots of good information on flu.gov that you can access.